It is Monday, May 11th. Welcome to our daily update from the COVID-19 task force here in beautiful downtown Kahnawake. We have two presenters on today's update. Lisa Westaway will be here shortly. We'll start things off with Lloyd Phillips, the Commissioner of Public Safety, with a couple of significant announcements to make. Lloyd?
Thank you, Joe, and good evening, everybody. Hope you're doing well. I know it's still tough times for our community, but I hope you're making the best of it. Just a couple of points I wanted to make today. I'll be brief, but I think there's two important announcements. One, obviously, is an extension of some previous discussion we had with the community regarding the Kahnawake Economic Revitalization Plan, and looking forward to saying when could some dates be assigned to when we're targeting the opening of businesses within the community. So after much discussion and debate over the past several days, and actually even longer, but more concentrated over the past several days, taking into consideration the health and safety first and foremost for our community, the social and psychological impact on the community, and how it relates to obviously the economics and so on. So all these factors were taken into consideration, and also looking at the medical issues around Kahnawake in the greater Montreal area, which includes us and our neighbors, when they were targeting their opening date. So with all that said, when it comes down to it, the Kahnawake COVID Task Force is targeting the date of June 1st. If all the conditions are met and the situation stabilizes in the area, and that is the target in which we're shooting for to give the green light for the first phase of business reopening to take place. Again, this is a very fluid situation. There's a lot of information out there. We're being guided by the principles of health and safety for our community, and not forgetting the fact that we have obviously the business and economic aspect, which is a major contributor to our community. So with that said, June 1st is the target date. No, that's not etched in stone, but certainly we want to make sure we have a focus of our energies, and if all things are in line on that date, we will definitely have June 1st as the opening date for our community. So also along the same lines, equally as important as the economics of our community is also the social well-being of everybody. And we looked at, again, many aspects over the past while, and obviously one element was that kept trending was the issue about people's pools. So we heard, we listened, and because people are still being told and asked to stay at home as much as possible, and the pool being an extension of that home, we have made the decision that we will be allowing for pool companies to come in to do any type of repairs, any type of openings that you may require, for your pool. So we will have somebody contacting all the pool, the commonly used pool companies in the area to inform them that if people can make appointments, that they are allowed to come in to provide that service to our community. We understand that the pool is an important part to many people's well-being. It's a means of feeling again a little more sense of normalcy. It also helps people feel more ability to stay home. If you have more activities to do, and hopefully the weather in the next week or so will cooperate with us. But that's I think some significant news for the community who've been looking forward to having that service provided. So I'm happy to announce that here today for you to take the proper measures that you have to do. But with that, I have not much more to add at this point in time. Lisa will expand a little bit on what we discussed and also some additional information. So with that, I'll see you again soon. Onigawahi.
Good afternoon. So just to remind you of some elements that we discussed over the last couple of days regarding the INSPQ article. And again, if you watch the news today, you'll see that Legault referred to it as well. So this is an article that was released late Friday that provided public health's predictions should Montreal reopen their economy as they were suggesting that they were going to do on the 25th. And so what we saw in the news today was a lot of questioning from the media to Legault regarding why he had not presented this information prior. And he stated that he was not aware that this information was going to be released. So we had talked about it on the weekend. So in fact, you probably did get the information before the Quebec area did. So just to reiterate, what was expressed in that document was that should loosening up of measures occur, that the expected death rate is expected to rise in the Greater Montreal area to about 150 people per day, and that's excluding the long-term care facilities. For this reason, and we really discussed at the task force, we wanted to be a little bit more cautious. We wanted to ensure that social distancing measures be maintained. We wanted to ensure that we have a really good communication plan leading up to reopening of business so that all of you have a good understanding of what's expected and what the criteria for success is. And for us to be able to do that, for us to ensure safety and health in the community, we've chosen a date of June 1st, which is a little bit different than the date that Quebec is presently using, which is May 25th. So again, that date is tentative, and it will change according to the data that we receive, but for the time being, that's the target that we have. So I just want to talk a little bit about the health check. It's still going very well. We've made just over 1,400 attempted calls and have spoken with 890 people. So that's quite significant. There are 29 people who did not participate in the survey, and there were approximately 500 people that we've contacted, or 500 homes where there was no answer. So this week we're focusing on those, repeating those phone calls so that we can try to reach as many people as possible. However, there are close to 800 surveys that were completed, so this is excellent. The impact of that is an increase in our testing. We've probably doubled the testing from prior to the beginning of the health check calls. So we're averaging about 8 to 10 tests per day. So that's great. So we'll continue to make these phone calls, and we'll have further information about results as we move along. Just a little point of information, there was a little bit of confusion in the community today regarding the bank. So there was the bank had to close today. They wanted to close due to their policy to clean when there is a possible suspect case. So there is somebody who was sick, there was somebody who was tested from the bank, and they wanted to take all precautions to ensure the safety for the community. There is no positive case as we're speaking today at the bank. So I think that was clarified on the K103 website, but in case you have not read it or heard, we wanted to give you that information today. So again, I know I spoke about it yesterday, but just a really big thank you for the Mother's Day event that took place yesterday at KMHC. It was really great. The residents were thrilled, and I think each of you were really happy to be able to do something positive. And somebody also brought us a really nice sign saying thank you to the KMHC staff. So thank you for all that for everyone who made that possible, including our employees who were very diligent with ensuring that everything was safe. That was delivered to all of the residents. So thanks again, and we'll see you tomorrow.
All right, thanks so much, Lisa, and thank you very much, Lloyd. Once again, in terms of positive news, there's a parade tomorrow for the first responders and people working the front lines. They'll be gathering over at the Kahnawake Sports Complex about 11:15. The plan is to leave from there and stop at the Peacekeeper Station, visit the Fire Brigade, head off to the Cattery Memorial Hospital Center if you can. put some decorations on your car, some signs and whatever. And it should be a nice little event. Again, that's tomorrow, Tuesday, right here in beautiful downtown Kahnawake. Just a note for perspective purposes, we've been doing this now for going on 2 full months, almost 60 days. And for those who are wondering about how effective our job has been over here, job one has been to keep Kahnawake healthy and safe. And again, for perspective, I was watching CBC a little while ago, and they mentioned that the Navajo Nation in the United States has the highest rate of COVID-19 in all of the United States. So, we can't take anything for granted. Our brothers and sisters down south are taking a beating down there, so we have to continue to do what we have to do to keep ourselves safe here. With that, I'd like to say thank you all so much for taking time. Again, some big news today, some important announcements, and we wish everybody, continued health and safety. We'll see you tomorrow right here for the COVID-19 Task Force Daily Update. On behalf of all of us, Nyao Koa Dano, Onigiwahi.